Ryan wants to be up here in the hot seat
No.
too. He's like,
I'll
no,
have
I'm
my turn.
You will.
I'll have my turn.
Everybody gets their turn. She looks very sweet.
We're a little behind schedule, Ryan, so if you wanna.
Well, I kinda wanted to.
Oh,
listen to
yeah,
that
okay,
part.
never mind, I'm sorry.
If
You're
that's
kinda
all right.
involved in this a little bit.
Public health side doesn't matter, but
No, that's fine.
So soft. Edible shirt.
Yours gonna look, it's pretty like rough.
All right,
All right,
start off with 42 home health care.
42, home health, yeah. We just take each line and just go right down the line.
Well, with the exception of salaries, we haven't really changed anything.
So do you just want to start at office supplies? Just go right down the line. Sure.
With their current staffing situation, salaries are a little bit up in the air, are they not?
Yeah. We don't have all the aides that we need to have, and
That's what I'm thinking more you.
He's 43.
He's 43.
No, I'm sorry, never mind.
Yeah, 42 is Loretta and the homemaker aides.
Okay. All right, office supplies.
same.
Labs. Haven't spent anything year to date.
Yeah. The reason
The
why.
reason, we haven't needed to at this point. Normally, for those, that is, our gloves and our, gowns, if we need gowns, which we haven't needed currently for them.
Usually it's like a one-time or two-time purchase.
Yeah, normally I don't have to purchase twice, and we haven't needed to right currently.
Are you, is it gonna take us $700 to get you have enough, or?
If we replace what we have, it would easily do 700.
But it hasn't been spent yet for this budget year, so can you spend it this budget year so you don't have to spend as much next budget year?
Well, it's kind of, you gotta buy supplies, you know, they're one-use deal basically, right?
Right, and if you don't want them to expire either, so that's kind of the
Because
issue.
those, they do expire, and
Mhm.
if you let gloves get old, poke your finger.
Yeah. Yeah.
All right. So you just time this again,
Mhm. Yeah,
so they don't expire.
yeah.
All right, postage and mailing. Which is sort of been at that level.
Is all this travel, that's for your home health care?
Yes.
A little under budget on that, any reason for that?
So because you're down an employee.
Shorter person?
Yes, we are short. Yeah, we're short one full-time employee. We have 2 PRNs, but they have only worked in the summer and when they're back from college.
Oh,
So
Can you hire?
we're trying to, but we haven't been able to get anyone hired.
We've had
At
that
that
ad out
pay.
for months.
And internet service.
Internet is for the service, their tablets that they have to carry around.
is there a reason why it's a little bit under budget?
A little bit under.
What you haven't spent,
Oh,
because that's monthly billed, isn't it?
yes, it is monthly billed. It's like $96 a month.
Okay.
Would that be due to shorter person you're not using, is that why it's down?
So you turn off the internet on that tablet then, when it's not in use? So it reduces the monthly bill, is that what you do?
I guess I would have to ask Loretta on that one. I don't have it.
That's what it looks like.
Okay.
Okay. Accounting, that looks pretty minimal.
And then what that is for is it's, for when I bill, Office Ally for our Veteran Affairs. That's their clearinghouse.
I'm sorry, what was that for?
The accounting, auditing, clerical.
For Veterans Affairs?
Wouldn't that come in the Veterans Affairs budget though?
Not when I'm billing homemaker.
Oh,
I
okay,
bill their clients.
okay.
and that's their clearinghouse to bill them, and it's $35 a month.
Okay.
Real quick, Heather, year-to-date for that internet service line is now $557.34.
Okay.
So they've spent some more out of there since this report was pulled.
Okay, that makes more sense then. Okay, thanks.
So they're on track.
I think that pretty much gets us to the bottom of 42, does it not?
Education and training, you're not, is that just your CEUs and your CEHs?
Well,
Every aide has to have 12 hours of CEUs per year. That's also the local public health trainings that Loretta goes to and one of the aides.
And they're required.
Yeah.
Revenue. So it looks like we've had some reduction in revenue here, and some have not been received yet. Significant portions haven't been received yet. Can you kind of go over that?
Yeah, for our homemakers, we had, more that were paying, on a sliding scale and in full fee, and they have since moved to, the Medicaid side of it. So, that's where that, because they've been paid less.
I don't know why they have anything. Historically, we've got quite a bit in there.
Right, because for instance, this go Medicaid, we had budgeted this current budget year $50,000 in revenue. We've only received $618.
And a year ago, we received 60 grand.
Yeah.
Is that,
Your
that's,
report's behind because of
Okay.
month end. So actually, as of today, they've received $21,263.29
Okay.
through November.
Okay.
So we're still behind because we can't get month end done, so.
Okay.
But if you add your December in there, you're not as far off as it appears on this.
Susan would probably have what was deposited into December to give you a more accurate picture.
Well,
but
that
I
looks a
just
lot
don't
better
have
than
that.
$618.
Right.
You're at 20 through November, you're in pretty good
Yeah.
It
shape.
happens when
Yeah.
month end's behind.
Yeah,
so because,
but
Oh,
that's that
because-
one question. The other question is you're reducing it from 50,000 to 40,000. Are you expecting less in Medicaid dollars?
Yes,
Okay. And is that because of,
we've had clients pass, and we just don't have the staff to refill in those positions. We do have a waiting list of 4 clients, but
how many clients are you serving now?
right now we have, we currently have 15 Lifeline and 35 Homemaker. Only 2 of those clients have both, so.
What is Lifeline?
Lifeline is
a little thing you press, help, I need help.
Yeah.
I
so if
fall
you
and
fall
I can't get
and
up.
It automatically calls your emergency contacts, and if they don't pick up, then it calls the ambulance.
Okay, but that's not something we actively are engaged in, right? It's just a service?
We are engaged in it. If they fall, it
Well-
sends us an incident report, and we have to
Okay.
follow up with the client.
Okay, but it's
Find
not
out
like a
what has
regular
happened.
weekly or daily thing that the
No.
homemakers do? Okay,
No.
that's the 35 people you currently serve from the makers, that's where the more regular visits are? Okay.
What type of services do the women do?
The homemakers do housekeeping, and housekeeping. They also bathe clients, they do meal prep.
Helps them keep staying at home.
Yep.
It's very important.
And are these services things that can only be done by the county, or are there other private services that can do this?
I'm sure that there's other private services that can do it.
Then it becomes unaffordable.
Yeah, there's folks that kind of fall through the cracks, and they're not on the full Medicaid, and they can't afford the private pay, and well, that's where we come in.
They're right on that line. So if you could hire another person, that would potentially bump this up, because then you have more clients. you know?
We kind of,
But also bump up costs to expenditures.
we have a ripple effect, we had that, with those numbers.
And what's PHS state grant, is that kind of supplemental with the Medicaid, or what's that all about?
So that is money that we have coming in, that they reimburse us for our Board of Health meetings that we do, Board of Supervisor meetings. It reimburses, portions of, the salaries for
Is,
different things.
is that the grant that's going away in 2027, or is that something? different?
Yes.
Okay.
It stays with population count, or it's going from non-population count, so.
And the non-population is your homemaker services, it's your lifeline, it's your,
So we don't lose it, but it
footprints.
gets all moved over to population count.
What is that?
As anything other than home services.
Okay, so this $30,000, you could not use it for homemaker service starting in 2027. It would go into the, what is it? 43, Department 43? Okay.
All right, private pay sliding scale.
Can you kind of explain that a little bit, private play? So does that probably mean that they pay on a scale of what they
Yeah,
have
so
on their, based
what
on
the
the
rep
income?
does is she goes in and does an intake. She looks at their income, what assets that they have. If they, don't have any money left over, they can't afford what they have. We have 3 clients currently that we do homemaker services for, and they do not pay us anything. They are covered under the local public health grant. So all of their services are covered under that. If they owe anything, we have some that pay as little as $3.90 an hour. We have 2 clients that pay $31.20 up to $39 an hour. Those are full fee. So it's dependent upon their income, where they lie on that sliding scale.
So if they fall below, then you take it out of this grant money? Okay.
Yeah.
So there's 3 people that are, 3 people covered under the grant. Is there anybody else that's partially covered under the grant?
Yeah, anyone that has a sliding scale that doesn't pay the $39, but they cover the difference.
And how many of those are?
So, 8 additional.
So 8 are
And
covered
then
partially
it
by
also,
that?
yeah.
So
And then it
out of your
covers the
30
differences in that.
Out of your 35, 11 kind of fall under needing a lot of help.
Mhm,
Okay,
yeah.
So-
financial.
So the rest then, the 25 are full fee?
No, they're covered under Medicaid.
Oh, Medicaid.
So, yeah.
Okay. Well, how many people are full fee that are not covered by anything?
It'd be too many if it's more.
We have 2
Two that are completely covered?
that
That
pay
pay for it all? Oh, that's
Okay.
okay.
So,
How many hours a day is that?
Are you asking how many hours they spend in their home?
Yeah, for a typical client, how many
A
hours?
typical day, they're spending anywhere from 6 to 8 hours a day.
Oh, in the house?
in each and every
In
Not in
class?
each and every house.
Oh.
We have 3 clients that get seen, well, let's see. That one gets seen 4 hours a week. That one gets seen 3 hours a week.
So it's not an hour a day, maybe?
It's anywhere from an hour to an hour and a half. A couple clients, they get seen 2 hours a day.
So average 1 to 1.5 hours per week per client.
Mm-hmm.
Okay.
Yep. The ones that get the baths, they normally get a 2-hour visit.
And you said there's 2 of those?
There's actually 8 people that get baths.
Okay.
So then are they there 3 times a week for maybe an hour and a half?
Yes,
Okay.
for those individuals, yeah.
Okay, I think that's the end of 42. Expenses.
So you guys just plugged in a 5% pay raise.
Yeah.
So let's go ahead and to office supplies. Doesn't look like you've spent a lot of your $1,000 this
I haven't.
Can you lower that, Susan? I mean, you've gone,
Probably,
That's one of those things that happens all at once.
yeah.
Real big.
And historically, you've been over that most years.
I mean, if that's what it is, it's just, you've only spent $156 this budget year.
but you said we're behind, so it's,
Expenses are not,
okay.
just revenue.
So are you expecting to do a major purchase before June 30th?
I wouldn't say massive, no.
Okay, so do you think you'll need $1,000 this year and the next year? Okay, do you think we can lower that a bit?
Sure.
What do you think would be good, 750?
Do what you're comfortable with, Susan, you know what you.
Let's just assume that you'll be making a purchase before the end of this fiscal year,
Yeah,
and then base your decision on that for next year.
great. I'm comfortable moving it down to 750, just with, keep in mind if, you know, you might have to bump it up depending if when.
Medical and lab supplies.
What is that?
So medical and lab supplies for 43, those are our vaccines that we give, and all of that has increased in pricing. And for instance, I brought my little immunization book to tell me. So
Now, they have a short shelf life, don't some of them?
yes, some of our vaccines last 18 months, some less than that. But like for one box of our rotavirus that we use is $2,329.72. Our Gardasil is $2687.73 for a box of 10 syringes. So, I mean, that's kind of why we haven't really dropped that down in pricing any, because when we do have to buy, it's crazy. It's crazy expensive.
And this is for, when people come in to get a vaccine, do you charge them a copay, or is it covered by Medicaid, or how does that work?
It is all, depends upon their insurance. We do bill insurance, for those that, have no insurance or are underinsured, then yes, we cover it.
Okay.
So it can be free for some people.
But there should be an offsetting revenue.
Yeah.
Sorry, we'll get to that.
Okay.
Yeah.
All right, safety and protective supplies, emergency preparedness.
So those, we're supposed to,
All over the place.
yeah, we're supposed to have a backlog, of safety equipment, for any type of pandemic that arises. So that's gowns, that's masks, that's goggles or face shields.
Are you planning on making a purchase to use the rest of what's budgeted this year? Because you've only used a third of it.
Right, I currently have not, because I've been talking with Bobby and she says we're good still so far with the equipment that we have or the supplies that we have
Okay.
So
for
you
right
could
now.
So could we lower that if we're good?
Well, if you look at, 2020 was COVID year,
Yeah,
but then
Right.
22, 23 was 14 grand as well.
Yeah, why'd you use some 14,000 for, what'd you buy?
Do you get grant money for the emergency preparedness? Like, is
Yes,
there-
we do get
That's a
grant money.
grant,
That's-
right?
Oh, that's,
That's
oh,
what
that's
versus-
a grant?
Yes.
Oh,
Emergency
okay.
preparedness is a grant.
Okay,
Yeah.
all
Yeah.
right, okay.
So it's okay.
So the more they receive, the more they can spend.
Got it.
Yes.
You get the
Oh,
grant,
budget,
but
but
you
they
buy
got
the-
it.
buy
Okay,
the
all
stuff.
right,
so we'll
All
stay
right.
on.
That makes sense.
All right, advertising and marketing.
What do you advertise and market?
We have an ad in the shopper
Yeah.
that appears, and that's $46 a month to appear every other week.
Is there a reason why you do an ad in the paper?
It tells the constituents, everybody, I guess, what we do, that we advertise our homemaker, we advertise, that we do immunizations, we advertise.
Could we do that on our website?
We can do that on our website.
We do that still as
Yes,
well.
both, you do both.
What do you think about eliminating this? Because we really don't advertise for any of the other services our county does.
Is this where the?
Or is this a legal requirement?
The legal notices?
We have a legal notice too, that,
Yeah, we have
for
to
the
do
public
legal
health.
notices.
Is that a different line though?
no, it's all in that.
It's all in advertising?
So a lot of this goes for your legal requirements? Then that 46 a month
Well,
goes.
well, that would, what legal notices would you do, for instance?
Board of Health meetings primarily, at least that's a regular one.
Okay.
Just a special meeting with Board of Health.
But the advertising for your services is not a legal requirement, is it?
But you want to provide service. You're
Well,
not
of
spending
course.
any money.
It's
Yes.
not a requirement, but
Well, and that, a lot of the elderly have computers to go out and look at the websites.
So you're doing it as a courtesy to the elderly.
Right.
Well, if you put it on the website, you have to look at the website to get the information.
You have to look at the paper too.
That's
Well,
falling.
A lot of old
that's
people look at.
falling at your door every day, every week. All right, postage and mailing.
I upped that 3% simply because that's what stamps have went up.
You must have a lot of stamps in the drawer this year, though.
Yeah, because you haven't spent anything this year. Is there any way you could purchase it this year?
Yeah, I mean, I could. I normally go through 2 boxes of envelopes, and right now I know we have 1 box left, and a box of envelopes are oh my gosh, it was expensive.
They're terribly expensive.
Isn't that
You
something?
you restock your envelopes, your budget's spent.
Yeah,
All right, Lifeline. Look.
And that's reimbursed, right?
yes,
Okay.
yep,
Employee mileage and travel.
yep, so that's,
Home health care?
No, that was the
no,
last
this
budget.
this is public health, so this is, Sean's going to admin meetings that are out. And this is covering, Lifeline mileage, which that's what that one is, and then, my mileage.
So Lifeline mileage is not included in grant reimbursement, or is it?
No, do not believe so.
Shouldn't that mileage go into the other budget in Department 42?
Well, we've been told to keep them separate. Yes.
So what I'm saying is, if it's in if it's for Lifeline, the mileage should be in budget 42, it shouldn't be 43. Because it's a
But
different
Lifeline is
department.
43, because it's a public health. Lifeline is public health.
Oh, okay, that's,
It's
okay,
not
I get it,
homemaker.
okay, got it, okay,
So that's why it's separate.
okay.
That brings us down to emergency preparedness.
Haven't spent anything
Employee
this.
Girls, you've hardly ever spent
Hardly
any.
ever spent anything.
What's that?
In mileage,
No,
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 emergency.
it's employee mileage and travel for emergency preparedness.
There it is, yeah.
And you've never spent more than $232, so how
Can
come
we lower that to 250? Is there a reason why it's $600?
That's- I'm fine with that.
never spent it?
All right, employee mileage and travel for Lifeline. That's when you have to go check on somebody, is that kind of?
yeah, that's when we have to go out, maybe they have a low battery or, their button stops working, so we have to give him a new battery.
That's good. Telephone services, is that, what is that?
Yeah, that's a little pricey.
So our telephone, that covers, our Quest, our landlines, and then it covers, a portion of the cell phone. Because 42 doesn't have a telephone budget, it's all included in 43.
Should we make a telephone budget for the cell phones for 42? Make a line item for that? Because we really shouldn't put it in this budget if it's the home care tablet and cell phone and stuff like
The tablets are under 42.
Yeah, they were around 42 when we went
Yeah.
through that.
that. Okay, what about cell phone?
So the cell phones are paid under 43.
Right, but are the cell phones all 43 employees or some of them 42 employees?
Some of them are 42.
We should probably do a line item for that, under 42. What do you think, Shelley?
You sure can.
What do you guys think?
Probably makes sense, at the end of the day, it's 6.5, doesn't it?
Well, yeah, I mean,
But
it's
in the
the
right
same
bucket.
pot, but I'm, for accounting purposes and stuff, we
Well,
want
it's
to know.
not
how
gonna
much.
change it, but it's gonna put it in the right bucket.
Right.
It's not gonna change the money. All right, I don't care, we can move it if you want, Shannon.
So I'll just need Susan to tell me what new
I'll split it.
budgeted amount for public health is and what, and what new budget amount is for home health.
All right, communicable disease, education and training.
If not historically, well,
What year to date you're about there?
yeah.
That's, everyone's supposed to have,
All your-
CPR, so, but for 43, it's me, Bobby, and Sean, the admin. And we all, everyone in the building and our aides have to have CPR. So they have their budget, we have ours, and it's also, we have to have 12 hours of CEUs apiece as well.
So you budgeted 500, you were talking about the emergency preparedness one, weren't you?
Well, we haven't got there yet, we haven't spent anything on that. In the
Yeah.
first line, it looks about right. The second
First,
line,
yeah.
we haven't ever spent that.
Yeah, is there a reason why, what's that for? The education and training for emergency preparedness, we've budgeted $250 every year and it's not been spent.
I honestly am not sure what that is for.
You've never spent it, so maybe you need
Let's
to put
remove
that
it.
down to,
Let's remove it. Do you want to remove it? We've never spent it.
Well, it only hasn't been there that long, so there must have been a reason it
it's
went
only
in
been
there.
there
Well,
for
then,
22. I
If
wonder,
it's a
It's probably put there after COVID.
emergency preparedness, it's something that would be reimbursed if it was spent.
we're down on page 2, down 3 from the bottom. I wonder if that was something that they told you you had to do after COVID, I don't know, but you've never spent it, so I'm just guessing if they made
You
you.
know what, looking at it, I'm wondering if we added it after the tornado.
Well,
What do you think?
they weren't that in,
When it was living.
I don't remember any of those ones.
I don't think so either.
Okay.
Well, unless there's a reason it has to be there, let's drop it.
I think so.
Planning, management, consulting, look, that was a one-time deal.
Well, those are job share.
Dues and
So
membership.
that's every 6 years.
What are your dues? Because you've not really
Every 5
spent.
years.
Our dues and memberships, that is, oh my goodness. I didn't write all of
I
them
think we
down.
spend it every year.
Yeah, it's our IPA,
Oh, and do you have IMSA? You
fees.
probably don't.
no,
IPA,
we,
okay.
Sean got rid of one already, because it was 950.
NACO, you got rid of it, yeah.
Yeah.
We do public health, group, what was that, the chain?
Yeah.
Did they increase it? Is that why we budgeted $700 and we haven't spent it yet? I'm assuming it's because they haven't paid it yet, but are you expecting to spend $700 or?
Yeah, because all of our dues, we spend,
It went up?
some are every year, and a few of them are every third year, I believe.
Now,
Okay.
do some of
So
these
it's like-
dues you pay afford help you, like with the paramedics? It gives you insight to a lot of things, is that true with you?
Yes, for the IPH, I know that that is the case, yes. Not sure.
is really to keep us informed of what's going on. Because that is actually one of the primary ways that we get information is what's happening in the state and what's happening.
Okay, thanks. Okay.
All right, let's move on to the next one, equipment rentals lifeline.
So we have to pay for the services for the equipment and for the monitoring.
But then are you reimbursed? Well,
Yeah, it's on the revenue line, so they're reimbursed.
Health insurance it is. All right, let's move to 43. Revenue.
So the state's increasing their grant for immunizations.
Yep, to 9,100
Okay.
is what we can be reimbursed for that grant.
so if you do more, you only have 9,100. If you do way more, that's all you're gonna get regardless.
All right.
There's the grant. Are any of these grants all in perpetuity, or any of these, you heard of them lowering, taking them away, or anything like that? Any risk?
Nope.
Okay.
What's the CRI MSA grant? It looks like it's kind of been all over the place.
It's a part of the FEP.
Part of what grant?
It's a part of the FEP grant.
But
It's
a year
difference.
ago, it was 26 grand, and it's never been that high before or since.
Yeah.
Did you really receive 26, or is that a error?
Here.
Because they never.
No, because we, that was a part of the tech grant that we received.
Okay, so
We
it's
had
kind of,
received
gotcha.
27,000.
To do that every 6-year study, got it.
Okay.
LPHS state grant.
Looks like we haven't gotten anything in the past for that. Is that a new grant?
Well, that's, you had discussed last year, you wanted the.
Oh, we wanted each grant split out.
Yes, so the
Okay.
homemakers is on 42, the,
Got it. So she's got it.
public health one is on public health, so that's why it's split.
Okay.
So you just split the grant.
Yep,
Nursing services.
Is that,
Wow.
looks like we haven't gotten any revenue on that. Is that something that, shall we give updated numbers for that one?
When we budgeted about half what we've been receiving.
Right.
It is page 1 on revenue side, 43,608 is the last four numbers.
Shows we've only received $455. I can't, assuming we received more than that. We budgeted $10,410.
So I only have update to November, and it was 748, it was 749 total.
$749. Okay.
Why is this? Why are you not getting these revenues? Explain that.
Done.
Month end means the treasurer hasn't completed
We
this?
can't balance month end, yes.
Is that, do we know what the issue, before we go any further, do we know it, because we're in accounting this with we've encountered this with every department. Do we know when that solution's gonna have that resolved?
Nope. I asked for a follow-up and I've yet to get a response. So,
Did they tell you what the issue is, or?
the solutions told the treasurer what the issue is.
Okay.
Susan, do you have an updated, do you know what you've sent them to date by chance? Probably not with
I
you,
don't.
but
I'm
yeah.
sorry, I
No,
don't.
that's okay.
So Lifeline is a little bit, do we maybe have more of that too?
so Lifeline is equal to what we're going to be spending out. I know currently with Lifeline, we just spent $511.75. It had been down because we had had some clients die, pass away. But we have added some new clients, so if we continue on the path of the amount that we have right now, we'll be spending 6141 for 12 months. And right now, we're gonna be reimbursed that.
So it's a wash.
Hopefully,
So
yeah.
you're going, okay.
Yeah.
It's just if we can get more funds, we need that there.
Okay.
Okay, I think that's it on that.
Yeah.
Sanitation.
Okay, Department 23, environmental health. I did not get a budget sheet because that's kind of up in the air, an updated one. So everything is just what it was last year. So if changes need to be made, now would be the time to make those changes. But as of right now, everything's still the same as it was.
So this gets into what proposing that Mike does on a contract basis for a while anyway. Is there any merit to that being a permanent solution or not, or?
Well, based on the discussions we all had in our subcommittee, the idea of Mike coming in is to kind of give an idea of, is it a full-time job, is it a part-time job, what's the actual cost, what's the actual workload? He's gonna assist Ryan in public health in figuring that out. I think the consensus is that to leave things the same until they figure it out. And then if we need to hire full-time, that way the
That way
budget
it's
will be in
budgeted.
there. Now, has this accounted for moving the stuff to Warren County, the dial and the other thing?
That was some of my questions, on the budget was, like the Gransky County stuff, is that gonna be gone? Those are questions I don't know.
Yeah.
So as far as we know, as long as Joelle is cool with it with her board, and I think they met last Wednesday, seemed like we did. I think it's good to go. There's a little, it's a little odd. What we kind of wanted was just for her to take the contract and just do it. But we're doing a 2080 instead. If the inspector comes out to our county and they're here for over an hour, then they want to add on the price of that hour, which I think is, depending on what it is, it's around $75. So other than that, there's nothing extra coming out of us for the Gransky County's program.
Is this what we're relinquishing to Warren?
Yes. Dial, which Joel's quite certain is okay, that they didn't change anything. That is good to go, and they're just taking it.
Why would you want to give up a county duty to another county?
Well, in this case, and Heather and I talked about it too, I just kind of felt like we kind of need a clean house, and Warren is geared up to do that. They do it for Polk County as well. Other counties like Guthrie County, they handle various portions of neighboring counties as well. And I don't want to, since I'm not going to be here, I don't want to push anything of my opinion, but I just think that letting Warren have as much as possible while we get our stuff together. One of the things we're doing is moving environmental health over to zoning, or hoping to. I think that's part of this house cleaning. So that's kind of where we're at. To have hung on to Dial and hung on to Gransky counties, we found out that neither Tina or I could do water tests, for example, because neither one of us had the required CEUs to do that. So it just seems like a good idea to have Warren take up those two things, and then
And it's not permanently, it's just the
Yeah.
contract's only for a
Yeah.
year. And then we can always take it back depending on, you know, if Mike gives us good feedback, you know, and then you would come to the board again, give us an update, and then we can decide whether or not we wanna continue, but, the idea is, to your point, was to clean up a lot of the stuff that's outstanding on the septic side, release a lot of the pressure, and then once they get their feet underneath them and they figure out, then come back. Because if we decide we wanna do full-time, then we can pull all that stuff back from the line.
Now, Sean, you mentioned moving environmental health into zoning. Your board's in favor of that, because your board wanted to pull it out a few years
You
ago.
did pull it
They
out
actually
because,
voted in favor to do that, just at their last meeting.
and it was always under zoning when I
Well, and
worked.
Tina's serving a portion of that anyway, so it's been kind of, in my opinion, a kind of a convoluted mess ever since.
I
then.
like
It,
it.
it was, because you had two separate buildings,
Yes.
it just didn't make any sense.
Somebody comes in for a building permit, then they gotta go somewhere else for the septic permit.
And Aaron's working on the language to make sure, you know, it's legal for that particular
Well,
resolution.
the board said it was Iowa code, it was supposed to be under, but we always had it with zoning and it actually functioned better.
Ryan, what are your thoughts?
I think, I mean, in talking with Aaron and the committee, that it says the public health board may.
It wasn't a requirement.
Yeah, it wasn't a requirement. I think it would be beneficial to not only our office, but the people that are pulling permits, to have them in the same building.
And the other part of that is, it seems like there's gonna be some reorganization on the state level, and public health may well be one of those. So if you've already taken that environmental health out of there, if the state takes over public health, you don't have this one little entity out there hanging.
I think the most important part right now is trying to get clarification on who they're reporting to.
That's what
Like,
Aaron's working on.
Right, if it's gonna be moved from the Board of Health to the Board of Supervisors, and what my role in that's gonna be. If it's signing a timesheet, because they're in my office and I know they're there, fine. And anything beyond that extent, I'd like to know what that's gonna be.
Yeah, and that's, Tina's got some history with that, but it's pretty, it's not been under your
Yeah,
umbrella since you've taken this position.
I've learned a lot, and think I could, I mean, in her absence, I have issued septic permits,
Sure.
and I know enough about them to do that, but if it's a more complex project, I would want somebody that has more background in it to at least walk me through it.
So what's the arrangement with Mike then? It would be a contract type of thing?
It's a part-time temporary.
What's he doing right now?
He's
They
retired.
just hired
It's
him.
hunting.
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 Well, good for him. Well, those seasons are coming to an end.
We
here.
better hurry up. Yeah, Wednesday's it. I'm keeping time, so
I-
let's
I
move
know-
along.
I hope we
Okay.
get out Wednesday after this apocalypse and get our one more shot.
Well, that's when I talked to Mike, he answered, hello, and I said, hey, Mike, this is Sean, and everything. Oh, okay, I'm in a blind right now.
Oh.
He's better than me. You would get a text from me that says, sorry, I can't talk to you.
Yeah. So the Board of Health voted, in both cases, they voted to hire Mike at their last meeting, and they voted to, move it from public health to zone.
Good.
So then they're just kind of, the whole paperwork process is. So on our agenda for next week is the hiring of Mike, but
It's on the agenda for tomorrow.
sorry, tomorrow. But Erin, I don't know if she's gonna have that resolution ready to go for the moving yet, so, but
Where
we
are you
need
gonna house it?
somebody.
I think we're gonna move those filing cabinets into the vault.
And that will be the office,
Have an office.
okay.
That makes sense.
Yeah, that'll work.
So one concern that I had when I was looking at what was proposed, or what was last year's, is accounting for the same 5% that I'm gonna account for Tina on the zoning side, having it be in here too. What that's gonna look like with, I think Mike's being paid $30 an hour. If we do hire a new employee, I would probably assume that it's gonna be right around that same rate.
Well,
Part-time or full-time, I don't know.
Would you want to hire a new employee? Mike has lots and lots of experience. Would you start somebody that high as he's leaving?
Probably for a new person we wouldn't, I would think so.
I wouldn't
That
think
depends
so
if it's
either.
full-time or part-time.
Yeah.
That too.
You could pay someone $30 an hour part-time and be cheaper than $20
Yes.
an hour full-time.
Yes.
Right.
Um,
And is, Mike is just, since he's a temporary employee, does he get IFRS and?
Part-time. We might, when you get
Oh, that's right, he's
We'll
part-time.
have to keep him
He's
under those
part-time.
hours, but he'll be consecutive quarters, and then we'll have to start paying in.
You said he's only gonna do it for 3 months, right?
That's if you can find somebody, I mean, that's another piece to the puzzle, is finding somebody that he can train within an amount of time to do that position.
So we need to probably we need to start advertising that, so when we have him, we can start training somebody.
Well, pretty early on you do anyway, but probably be good to get Mike in here
We need
I would
to
like
work
to have him in
kind of
here
figure
for
things
a
out. We
month,
need to
probably a month,
advertise,
to
yeah.
be able to straighten some of the stuff out, get him
Okay, then after
comfortable with
month.
geo permits and cleaning that process up, before because he's gonna have quite a few tasks and getting things in order before he can set aside the time to train somebody.
Yeah.
We're still pretty early in the cycle. For right now, I kind of like to plug it in as is, come revisit it.
Well, the point he is making about Tina, because her salary is, half of her salary is in environmental health,
Yeah.
is that the point? And he didn't plug in that 5% in that salary, is that what I'm hearing?
But, right,
Okay.
but then, is there gonna be an offset in there where it's gonna be covered, the 5% if we do that? But I would like it to be known that I'm pushing for her to have 5%.
On this side.
On both sides, yes.
Okay, understood, all right, I get your point. But
But
yeah,
anyway-
you're right, it would probably, this would have enough cushion to cover it.
Yeah.
Heads up, there's not a resolution tomorrow to hire Mike.
I think it's just under new
It's
business
just new
discussion.
business, yes, because we didn't know who he was reporting to, so you can't prep a
Oh,
resolution
You're right.
without knowing who
So
they're
it's just a
gonna report to,
discussion.
so it's a discussion item tomorrow.
If Aaron gets the paperwork done, we can always make the construction meeting a special session, pass it then.
Let's flag environmental health for now. Assuming we're getting Mike on board, and then Mike and Ryan can revisit this and bring back revised numbers. Is that fair?
Yeah,
Yeah.
yeah.
Do you want, are you guys okay doing approving this during the construction meeting next week if Aaron gets the paperwork done?
It will, and if they're I think they need to sort of know the direction they need to go to.
Well, no, we have to hire him first before they can.
At the construction meeting,
Are you okay with that, just doing 2 resolution? I don't know if she's needing them done, I don't know. But I wanna just kind of put that bug in your ear.
I don't
The other
know.
thing-
I'd rather it be at regular meetings.
Yeah, I don't want to kick it out 2 weeks though. There's no
Yeah,
sense
2
in doing
weeks.
that. The other
I
thing
don't
we-
care.
The other thing we could do, since it's kind of budget related, at the end of today's sessions, we need to figure out one more date for all the other miscellaneous things.
Oh, and do
We
it
could
then?
We
do
could
it
do it
then.
then.
Okay,
That's smarter.
Okay.
That would be better. Let's do
Okay.
it at the next budget.
Yeah, I'm getting ahead of ourselves there, but okay. So for environmental health,
Just leave it as
we're
is.
not gonna touch it now, we will revisit it after Mike and Ryan have had a chance to get their feet wet. Does that make sense?
okay.
And there's your, 23 revenue. We'll look at that quickly, I'm gonna say that's probably similar sort of
Yeah, a few things that I had there was, again, swimming pools and spas, does that need to be on there any longer?
Not if you're giving it to Warren, and plus,
And then the annual fees, what's
Well-
happening there? We don't
but
know.
in case you take them back, don't you?
Well, for the swimming pool spa licenses, is that the, grant, is that get out of the grant?
No.
Isn't that what you're giving to Warren?
Because I think that under the contract, if I recall correctly, is we
That'd be the
retain the
dime.
revenue and then they bill us and we write them a check. if that's the case, when it's still remaining, have to remain in here.
So you thought that
I thought,
we got the revenue and then we paid them?
that's what I thought, that's the way I thought the contract read.
I think that is the way it's set up.
Okay.
So then what are we paying that out of?
To Warren County?
Mhm.
But yeah, it's not in, it wouldn't be in there.
Cause it's it's just going in and
Yeah,
out.
but you still have to have an expense line for it.
Well, it would still, we would put swimming pool and spa licenses and maybe just put a note under there, Warren County. Well testing and abandonment, would that be Warren County, or well plugging?
No, that's us. It's
Well, no,
still,
we're moving the well stuff.
Well, permitting would be under us, well,
Right.
plugging would not.
we're gonna go under Warren now to do well plugging.
Yeah.
So I had to go to Warren and I plugged those 2 wells in St. Charles.
No, what do you mean?
I just plugged 2 wells in St. Charles, so if I do that again, I have to go to Warren County to do it.
You'd have to contact them,
Yeah.
and then they, based on the contract, they would do it, and then they bill Madison County for reimbursement under the grant. Because the naming of the grant is to us, not to Warren, so I think that's why the contract said that on there.
So you're probably gonna have to note this as an expense, but then
Yeah, so
put it.
any money you're bringing in that is getting sent back out, you're gonna have to have an expense line for.
Yeah.
So is the 23 revenue, like 23 expenses, we should just kind of pump our brakes on
I
it?
think so.
Okay. All right,
Yeah.
let's do that.